Yeah, but you look at those diseases, right? It's caused by the parasite or the tick. So what happens is it's not a cause within your body, it's an external cause. So that is another classification of diseases. It's the niche, which is your own body doshas, and then something is coming from external, but then it's creating issues within your body. So even the bite is going to lead to dosh prakop in your body. So your doshas are going to be out of balance. So if you have tremors, if you feel a lot more tired, there's a lot of fatigue, there's not enough nutrition, so depending on the symptoms, you would have to fine tune it.
So you adapt to the symptoms?
You adapt to the symptoms, because that's the first treatment, right? Like you can try the cleansing procedures, and there could be several stages as well. If you've just recently contracted Lyme, the treatment would be completely opposite of if you had it for a few years now. So even the time you've had the disease, a lot of things change. If you're getting a headache today, it could be a vata headache, that's fine, you can take care of it. If you don't take care of it, if the intensity keeps increasing, vata is the only one that can move in your body. There's a shloka that goes vatam, pittam pangu, kapha pangu, pangavo maldhatava, vayuna yatra niyante tatra varshanti meghavat. What does that mean? Pitta, kapha, any of the dhatus. Everything else is immobile, they don't have any movement. They are going to be stable, stagnant in your body, they will stay at a place, but you will need vata to pull them out or make them move itself. So the moment vata is moving, if there's a lot of pitta, right? So it mixes with the pitta, it's going to cause burning sensation at that area where it's moved to. If it's constipation, if there's an obstruction to vayu, that could lead to a constipation as well. If you have itching somewhere, it could be vata mixed with the pitta or kapha as well. So depending on what's going on, vata, and that's why vata is called the king of doshas, because he has the ability to move things around which others cannot. Any other questions?
Well, I guess getting back to the Lyme or just illnesses and just understanding, I knew that when Europeans came to India, or Portuguese in particular, to Goa, there was a lot of syphilis that came in, and that came in through Europe. But they'd had no syphilis, they hadn't seen syphilis before. But so the Vaidya's at the time devised, they saw through just the symptoms and what was going on. And with different people, they formulated these different, this particular medicine, and they were able to get rid of the syphilis, and they'd never seen it before. So just understanding the principles of what was being presented as syphilis and the symptoms, they thought this is what we're going to have to deal with, and they were able to make this cure, which apparently is still available and it still works today. So with the Lyme disease, depending on when this person has it, what it presents, who the person who has the Lyme, who's got the tick, like are they about to pitta kapha? How are they going to react? Because it seems that those symptoms are quite different with different people. I've studied the people that have had Lyme disease, and they all seem to have like a different reaction. So you've got to know why they're having a different reaction. What the pitta kapha? Who are they? How's your digestion? So then you have to just work carefully with that person.
Yeah, you have to find the dosha, like what exactly is happening, because in certain diseases there are some diseases which would be predominantly a dosha. So if you look at multiple sclerosis, does anyone know what that is? It's demyelination of the spinal cord, and all the fat starts degenerating, right? So it's increased vata. If you look at the symptoms, there will be slurring of speech, there will be incontinence, you cannot hold your bladder sometimes. Balance is off. There's lots of symptoms with MS, that's classical vata symptoms. So the chikitsa, the treatment you do, would be giving the opposite properties. So more oils, more fats,